Hello, we are here today on the Wellness for Life program. I'm with David Gottenborg of Gottenborg Chiropractic Clinic of Pelican Rapids and Monaga. Our topic today is going to be talking about people's overall wellness. David, what are some different ways that you can measure a person's overall health and wellness?
What we do is we offer really two unique services. One is a questionnaire. We call it a symptom survey questionnaire. The other test we do is a screening test, and it's called a hair mineral analysis. And I guess the reason why we do these is in order to assess your wellness, we sometimes want to unearth underlying causes. In other words, there may be a certain therapy that you're using that may have little or no effect on the underlying cause.
Could you tell me a little bit about these services?
Sure. The first one we do is simple, and it's free. And it's what we call a symptom survey. And really what it does is it's a number of redundant questions that we ask you to answer the question based on the severity of a symptom. And when we're all done, we enter this information into a computer, and what's generated is a report that categorizes your health into different groups. For example, low functioning adrenal, cardiovascular, digestive. So we use this as a tool or a starting point to begin to lead us in the direction of what may be one of the underlying causes.
You had also mentioned the hair and mineral analysis. Can you tell me a little bit about that?
Sure. A hair tissue mineral analysis is a simple screening test that we use to measure the mineral content of your hair. In fact, it reveals or measures some 20 different minerals and toxic metals. In addition to that, it provides us with information about your body's biochemistry, so we can make predictions or, in some cases, assess your energy level, how you tolerate sugar, glandular activity, adrenals, thyroid, and your metabolic rate.
Okay, and how does that differ from conventional testing like blood tests and urine tests?
Blood and urine tests, while diagnostic, still provide us with a lot of good information about the body chemistry. However, they only evaluate the body fluid. Whereas a hair mineral is looking at the body chemistry of what's going on within the cell that happens to be the hair.
How can you use that information?
The information, once we have it, is really quite valuable. We can do things like address mineral deficiencies or, in some cases, excesses, including toxic metals. We can use it to develop a diet that fits your type of lifestyle. And also we can use it to make sure that we find good vitamins and minerals that are compatible with your body's chemistry.
Who would benefit from having a test like that done?
Really anyone, but in particular those with a known illness where there is no explanation for the illness. Or for those that where there is a known cause, but the therapy they've chosen hasn't been effective. And then really for anyone who wants to know whether or not their vitamin or mineral, their plan, how they supplement their diet, is it effective? Is it compatible with their body chemistry? And so when we get the results back, it comes back looking something like this, where again it reveals some 20 different minerals, including those metals that are considered toxic. The test is very, very sensitive. In fact, minerals or toxic metals that show up are about 12 times, this test is about 12 times as sensitive as blood work. And from a test like this, we can tell, looking at the calcium, magnesium, the electrolytes, and then your trace minerals, is what you're doing compatible to your body's chemistry.
What are some of the common causes of a mineral imbalance?
The most common cause would be an improper diet, such as overeating carbohydrates and sugar. It could be from medications, birth control, and in some cases, whether in your job or your hobby, you've exposed yourself daily to toxic metals or fumes. So those are some of the known causes.
Well, thank you very much, David. This all seems very interesting. I hear people all the time saying, oh, I just don't know what's wrong with me. It seems like this would be a great option for someone like
Right.
that.
Yeah.
If you have an interest in learning more about the symptom survey or the hair and mineral analysis, check out the website and get in contact with David Gottenborg of Gottenborg Chiropractic Clinic.